So I'm here with Dr. Richter from Richter Animal Hospital. If you could tell us a little bit about your clinic and kind of where you guys are and how many years you've been serving pets in the DFW area.
Yeah, we're a small animal practice, dogs and cats exclusively. We're in Arlington, Texas, which is in the kind of the heart of the DFW metroplex, right, kind of equidistant from Fort Worth and Dallas. We've been in operation since 2004. We started small and grew from there. Me personally, I've been out of school since 2000, so about 22, coming up on 22 years. But the practice itself since 2004.
And so what is your clinic focus that keeps you guys successful or to remain successful?
Yeah, so I mean, a number of things, but our core focus is creating lifelong relationships. So creating relationships with clients, creating relationships with our staff, and then with those clients, communication, customer service, really just trying to go the extra mile for each individual customer, and trying to do something a little bit different, trying to separate ourselves in the way that we handle those interactions with clients. But, above everything else, that just those relationships and creating those really lifelong relationships. I mean, since we started in 2004, we've got clients that obviously we've seen since then that have been through multiple pets since then, seeing them from, puppy stages and until end stages. And, it's tough, but it's very rewarding as well.
How do you introduce subject of arthritis with clients, and how does that come up?
Yeah, so I mean, our technicians do a great job. Technicians start the process for any physical exam or exam visit for us. They're asking a number of questions about diet and history, which includes any changes in activity, any changes in mobility. And that kind of gets the process started for clients. Anything that they bring up, now that you bring it up, he is a little bit slow to get up and get around, or he is limping occasionally. And then the doctor will continue that in the exam room. For me personally, when I get to the orthopedic exam, that really is when I tend to hone in on that, focus on not only the examination piece, but the historical piece as well. So, let's talk about, what are you seeing at home? Is he slow to get in the car? Is he slow to get up after a nap? Is he truly limping? And what those clinical issues are at home. And I think that, the more that they talk about it, the technician has talked about it, the doctors talked about it, and then just more questions, more things come up, and the more they start to think about, now that you mention it, he is a little bit slow to get up and get around. I didn't think too much about it, but now that we're talking about it, maybe it is an issue.
That leads nicely to you. So are there any tools or anything that you guys use to broach the subject of arthritis, or like to educate pet parents on what to look out for? Is there anything specifically that you use, like a quiz or anything like that, or is it just...
Again, general questions. We don't really have a quiz or an orthopedic questionnaire. It's just those general questions, kind of getting that communication piece started, and then taking it from there in the examination room. And a lot of times clients are bringing that to us. A lot of times they bring it up before we even bring it up. So they know, potentially there's an issue. They've been educated, whether it's with previous pets or, things they're seeing online or on TV. But clients are really astute, right? They're well educated. They know their pets, especially now, with a lot of them being at home with them. I can't tell you how many more ACL surgeries we did in 2020 versus say 2019 or 18. I would imagine it at least doubled.
Wow.
And I think, some of that was activity with people being home. But a lot of that was, I think people were noticing more, they're seeing more, they're there more. And they're picking up on those clinical signs.
Y'all carry. What makes you recommend that, or how does that conversation get to Glyde as opposed to something else?
Yeah, we're just really passionate about Glyde. It was introduced to us, gosh, you'd probably know better than me. I don't know how many years ago. We've been carrying it for a number of years, and it was introduced to us. We tried it, and it just works. And that's, for us probably is the easiest selling point. Is we're not trying to push the product for any other reason other than the fact that we just think it works. And we've used a number of different joint supplements, and from a pharmacologic standpoint, I assume probably the omega-3s and the source of fatty acids in there that probably makes that more effective than some of the others. But for us, again, starting a dog early, being able to see results from a product like Glyde has made it much easier for us to sell.